Access to quality health care remains one of the most important issues in America. However, most people are unaware of the vast disparity between the treatment of physical health conditions and mental health and substance use disorders. Policymakers tend to agree, at least on paper, that insurance plans should not be allowed to discriminate against behavioral health conditions. Over the past 2 decades, the federal government and many states have enacted parity laws requiring health insurance plans to cover mental health and substance use disorders in the same way as physical conditions. The most notable of these laws is the Mental Health Parity and Addiction Equity Act, also known as the Federal Parity Law. Passed by Congress in 2008, the law restricts health insurance plans from imposing higher co-pays or allowing greater out-of-pocket expenses, placing more stringent limits on the number of visits or days of covered benefits, or using more restrictive managed care practices and services. It was a major win for those struggling with behavioral health issues. At least, it should have been. Discriminatory practices remain a serious problem. Health insurers are not uniformly complying with these provisions and limit access to coverage of medically necessary behavioral health care. That is unacceptable. The JEM Foundation has partnered with several organizations in Arizona to motivate our policymakers to introduce state legislation requiring insurance companies to enforce the federal parity law and ensure that Arizonans receive the coverage to which they paid for and are entitled. Join us in our efforts to end behavioral health discrimination. If you believe you are being denied care for mental health or a substance use disorder, file a complaint with the Kennedy Forum or with the state of Arizona and let them know that you are fed up with their lack of action on this important issue.